There you go. Oh, it's nice that it tells me.
So I am here with Steve Bicknell. This chat has come about because a couple of weeks ago, maybe about a month ago, I launched a book called ADHD in Sport. And I kind of thought I was the only person looking at this area, and felt like there really needed to be something. And the response has been amazing. Had so many comments and calls from people all over the world, some of whom are really pleased there is something now they can use, either coaching or working on themselves or with their children who've got ADHD and they're trying to perform at the highest levels in sport. And amazingly, from lots of other practitioners who are also trying to support athletes who have ADHD. And Steve was one of the first to reach out, and he's working over in Australia. Um, so I've got this amazing connection right across the world of working with similar athletes on similar issues, but thousands of miles apart. Steve next week is actually off to the Professional Association of Athlete Development and Skills in New York to talk about how to support athletes with ADHD. So I thought we'd get a little sneak preview, and we're going to spend about half an hour now just chatting through how we as practitioners on different sides of the planet both try to help our athletes with ADHD, so that you watching can get more of an understanding, maybe pick up some skills or some tips or some tools you'd like to try. And hopefully also realize if you are struggling in your sport because you have ADHD, you are not alone. If you're also flying in your sport because you have ADHD, you are not alone. And we're really going to delve into some of those strengths and those weaknesses or those barriers that might show up. So thanks so much for doing this, Steve.
No problem. Thanks for having
Personal
me. And
question
thank
I
you for
want
the
to ask
plug. Oh, they'll appreciate the plug. Thank you.
you. What triggered your interest in ADHD in sport?
Um, oh wow. Okay, the really quick version. I spent most of my career actually working in corrections, youth detention or with juvenile justice. And so we would see a lot of ADHD, but often see a lot of trauma. And trauma was sort of my bread and butter for a long time, as well as antisocial behavior. And obviously, we know ADHD and trauma very alike. They present in very similar ways, often hard to discriminate. So when I then started going private practice, was mostly doing trauma work, then ended up working for the NRL, which is a job I absolutely love over here. Um, with a slight curveball, my two daughters got diagnosed. And like many adults with ADHD, I started to decide, well, I'm going to learn all about this. And then went, hang on a minute, that's me, that's me, that's me. And then subsequently, a year later, then got diagnosed myself. So when we started doing the NRL work, really started to notice a lot of trends, a lot of the similarities, and just sort of reached out to our head of wellbeing. And to his credit, the great Paul Heptonstall, he was amazingly interested, completely non-dismissive, and said, "Look, let's have a look at this." So that's all where it's come from. And like you said, with reaching out, I gave a talk at our conference, and I think my email blew up the next day from a lot of the coaches, from staff, from players, just sort of reaching out saying, "Hey, this could be me."
Amazing. And I love that element of lots of people ask why ADHD is being diagnosed so much more now. Is it that there is more ADHD, or is it that it was masked very well previously?
Uh-huh.
And I often say it's kind of actually when you diagnose one person in a family, you're often diagnosing two or three
Yeah,
at the
absolutely.
same time. And often
Well,
it's
the
the parent.
neurodiverse find each. Yeah, the
Yeah,
neurodiverse find each other. So a lot of partners are, but they find out, but also their partner is, or their whole friendship group is, or the whole. Yeah,
yeah.
yeah.
Um, so yeah, often the parent will say that there's nothing going on with that child. They're exactly the same as me. And then a little light bulb will go off, and suddenly a lot of the difficulties that they've struggled with in life start to become clear, and that understanding can make a really big difference for them. So, two quick questions. One, for those of us on
Sure.
this side of the planet and the Americans, what's the NRL?
The NRL is the National Rugby League. So we think of rugby union, but way tougher, as we like to say. Um, Less penalties. Yeah. So yeah, rugby league is essentially that. Yeah. Um, I also do a small bit of work for the AFL. the Australian Football League, and we've started doing small little bits with the A League, which is our version of your English Premier League, but way, way, way inferior. They're going to shoot me for that, but yeah. But I'm sure, yeah, it's very hard to rival the English Premier League. And yeah, I do, obviously I work privately here in Sydney as well. So yeah.
Brilliant. My second question then was um, because you've been diagnosed and because you've got family members, how do you explain ADHD to the athletes or the coaches that you're working with? What's
Yeah,
because I'm really
yeah,
fascinated.
great
There's so
question.
many different theories of what
Mm,
might cause it or how it shows up. What's
for
your
sure.
description?
Um, Again, because I think you need to talk to an audience that may not have our clinical backgrounds. I think the best way I do it is strengths and weaknesses.
Yeah.
There's a, we've talked before about the idea of there's a lot of people out there who say it's a superpower, but they forget a lot of people hate just hearing, you know, it's a superpower because that doesn't explain why it takes me 6 weeks to write a letter to someone or respond to an email or something like that. That's not a superpower. So I sort of explain it in a way of strengths and weaknesses. Um, the other part I sort of look at it is it's often behavior that's misinterpreted. So especially with coaches, you may talk about the idea that they may speak to a player about, their formation on the set play or, or their positioning on the field and where they should be and where this should happen. And then they say, right, go. And the player does the exact wrong thing straight again. And what they're failing to take into account is if you've given that player a number of steps, you need to do this, do this, do that. There's short-term memory deficits in ADHD. They often have now because of the people-pleasing element. They may not ask or say, "I don't understand," because they want to please, and they don't want to be seen as being the problem. So when they go and do that exact wrong thing again, and I've spoken to coaches about this, and I've said to them, "What's your first thought?" And they're like, "This player is not interested. He's not here. He's not paying attention. He doesn't have his head here." Whereas if we turned around and gave them, say, well, actually, it could be because rejection sensitivity, it could be like the short-term issues with memory, it could be because they don't learn from X's and O's. Practical, show them how, or make them understand the premise behind the play. And I can't tell you how many coaches have gone, oh, and sort of you can see them have that moment going, I wonder how many times I've done the wrong thing.
Will you explain quickly rejection sensitivity? Because it's
Sure.
something I see a huge amount, but I don't think it's often very thought about or known about.
Yeah, sure. So going back to that idea of strengths and weaknesses, which basically I love to explain ADHD that way. RSD, rejection sensitive dysphoria, basically that perceived rejection and criticism is sort of twice the dagger for those who are neurodiverse. They often get accused of being soft, or they're not, they're not strong-minded. No, it's got nothing to do with that. It's just the way your brain works. The opposite of that is what we call RSE, or recognition sensitive euphoria. Basically, in layman's terms, praise lifts them twice as much. So you only just need to look at common strategies in business and schools around reinforcement to see, you catch more flies with honey than vinegar, right? So, but in a lot of like a hard-nosed sport, say like the NRL, to be praised and not go so hard is something, being hard on players and being tough is something that's been in the game for a very long time. To change that mindset is a very different attitude for coaches to take.
I think that's really interesting. I've been talking to some ballet schools about
Yes, yes,
ADHD and dancers, and the big thing in ballet is corrections.
yes,
And that's really going to be dictated by whether you see as a correction as a bad thing, it's a criticism, or whether you see correction as, wow, someone's taking an interest in me and is trying to
yes,
help me be even better. And you
yes.
can see that that rejection sensitivity filter could have a really big impact on how somebody deals with that.
Absolutely, absolutely. I've seen it in gymnastics. I've had a gymnastics client too. Same sort of principle. It's tough love, tough love, tough love. Yeah,
What are the strengths? Because I think that's what's I love about the approach when we've talked is
yeah,
that so many people, and I'm guilty of this myself in the book, we have a whole chapter for coaches on these are all the issues that might show up, and
yes,
this is how you can better help. So I aiming to be helpful, but
Mm,
the strengths bit can get lost in that. And
absolutely.
I would love to hear more, and I'm sure people watching this would love to hear more about what strengths do you see in ADHD athletes that they
Um,
can then go out and utilize?
absolutely. I think I mean, there's pages and pages of these if we really want to go through it. But the main ones I see, I think it's the problem solving. Um, they're more creative problem solvers. They're more innovative. They think outside the box a lot more. They, especially because you and I work in different fields in sport. I do mostly team sports, and you're mostly individual. Um, I hear players speak about the idea that they can pick what their opposition defender is going to do before they do. They can spot certain patterns. They can see, you know, they come up with ideas for plays that will counteract the strategies of the other team. Um, Even down to a few of, I still get my problem adolescents here. A lot of the time they're creative or problem solving, and I love it. It's actually about I've got to come up with excuse or quickly why I'm not going to get in trouble with mum and dad, and they're often the best ones to do it. Um, they're hugely empathic. They're very loyal, very people pleasing. Is a big part. They will be your best team player. They will give to the team as long as they feel a part of it and connected. The opposite can also happen quite easily, though, if they're burnt. And sort of the last one is they tend to read a room better, I find. They know who to go to for certain things. They know what areas of the field, they can see other people's strengths and they can see those things. And generally, they can get a lot done in a short period of time if they need to. Often have trouble getting started, but yeah. Um, those are sort of the main ones I can think of off the top of my head. But yeah, I mean, very supportive of others and but often can be to the detriment of themselves too.
See that a lot. That people pleasing element of putting others before
Mm,
themselves
mm.
can result in what I see in things like burnout,
Yes,
because they're just massively overdoing things and often not necessarily able to read their own body brilliantly.
correct.
So they can push themselves and then suddenly go, I've got nothing left, totally empty. And
Yeah,
often what they're
yeah.
pushing themselves with are things that weren't even for their own sporting endeavors, they were to help others.
Well, even I love the phrase that you use around having the mental currency to be
Yeah,
able, can I do that today? Do I have enough for that? Do I, yeah.
brilliant. So being able to see their strengths, but also being able to see the difficulties that might show up. What's your approach to working with an athlete? If you've got someone in front of you, they've either come with struggles and you've gone,
Yes,
nah, I can see what that's likely to be, or they've come
yes,
to you
yes.
with, actually, I've been diagnosed with ADHD and I can see
Yeah.
how it's harming or slowing down my progression in my sport. What kind of approach do you take?
Or there's option C, they know absolutely nothing about it, or they've got no idea they've got it. So often the first approach it can be actually saying, we do a small bit of screening and testing and say, Leah, look, this could be it. I'm not sure about you, but so many clients present to me with those depressive and anxious symptoms, but it's actually as a result of untreated symptoms of neurodiversity. And so the, I think just to put it in short terms and not spend too long is I try to help them to maximize the strengths. Okay, here's where you're great, here's where you're fantastic, here's where you'll do amazing things. Let's do that. But also here's where you're going to have to work harder. You know, um, well, criticism is going to hit you hard. You're going to interpret the coach's actions in many different ways, which us in clinical psych speak about. The idea of cognitive distortions or automatic thoughts. The coach didn't say hi this morning. He must be off me. That rejection sensitivity, the DMN spiral, and we watch them go. So that kind of stuff I think is very helpful, and just getting them to understand them. Um, if they're struggling, especially, I think showing people the idea of what is ADHD burnout or neurodiverse burnout, which a lot of people don't realize is a very real thing. And as we've talked about before, ADHD burnout presents a lot like a depressive episode or a lot like the symptoms of depression. But a lot of the traditional therapies that we do to fix ADHD burnout can actually, that would fix depression can actually make ADHD burnout worse. If we do behavior activation and say, you should go out and go do some activity and go and head out with people, right? If the activity has zero interest for them, it's going to make them worse. If they're going around people that they're not comfortable with or they're not their people, they're masking, so it can make them more tired. So, firstly, showing a lot of the athletes that that actually is a real thing that can happen. We also know, because ADHD highly correlated with perfectionism, a big thing that's in your book, and I love it. And especially a lot of our female athletes over here in the NRL often show the more types of of all the perfectionistic traits, but they almost seem to walk a fine line. You gently push them this way, and they can accomplish amazing things, be highly productive, but the gentlest push that way, and they can hit burnout. And the other sort of ways I like to help is sort of educating them around the idea of dopamine and the role that has, both short term, both long term. Those short term effects of dopamine can also lead great things like, certain social events, or you are exercise, or seeing friends, or completing a small task. But unfortunately, a lot of those short term hits of dopamine are addictions. So we see gambling, we see sex and porn, we see drug and alcohol use, we see risk taking behavior. But what a lot of people don't also realize is rumination. The actual idea of rumination gives a source of dopamine. But think of it as like a poison apple. It gives you a strong sense of dopamine, but gives off anxious and depressive symptoms. Whereas we try to maximize those long-term sources more of dopamine around connection, around purpose and stimulation, around love, and around creativity and innovation, and trying to boost those, which would often go in a depressive episode of a person who was neurotypical anyway. So those are like a lot of the main sort of themes I see and I work through with clients for sure.
I love that element of dopamine because I think that feels really tangible. And I've sometimes described ADHD as a deficit of dopamine. And that I really like describing it to people as if you're neurotypical, your motivation will come from consequences and importance. With ADHD, your motivation comes from challenges and deadlines and novelty and excitement and passion. And then, if you know that's where your motivation is coming from, let's design your dopamine around those areas. Where are you going to go out and get it so that you don't have that deficit so much? And you have to be really deliberate with where you're going to go and get it from. I
100%.
also love that idea you're talking about there of being really overt with, I can also get dopamine from all these things over here. And for a very short amount of time, they might serve a good purpose to me. Particularly often, I find things around eating. And we know there's very high levels of eating
Yes.
disorders within ADHD.
And it's not the good food, like it's not the healthy foods that give the dopamine.
No, 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 it's the good stuff. Um, so being really avert with, yeah, you could get dopamine over here, but it's not going to help you long term. And particularly as an
Yes.
athlete, you need long term health. You need to be fueling your activity brilliantly, mentally, well-being wise, food wise. And so let's find that dopamine that's going to be helpful for you and give you that feedback you need. So I love that idea of it. Thank you.
Yeah.
Um,
So Edward Hallowell, in his books, he talks about the idea of the reward deficiency syndrome. In other words, this is how much of the dopamine
ADHD needs, not to feel great, but just to not feel horrible. And this is how much that they produce on a natural basis. So they need to fill that gap with all those external things that we just talked about.
when you work with teams,
Sorry, we just had a sound issue, but all good. We'll work around it.
when you work with teams, are you advising them in general on kind of this is what you might notice? Are you going in screening to kind of try and help people? Are you brought in if coaches are seeing that somebody is really, really struggling and that ADHD might be kind of the root cause of that struggle? How do you tend to work with them?
Our referral pathway is very different in some ways. So I'm actually assigned to two teams, so I'm not a sports psychologist. I'm more for the mental health, for those things. You see me when things are going wrong. essentially. But they do use me across the league with every team for sort of any social behaviour, for trauma, and now obviously for neurodiversity. The workshops we've been doing with the coaches it's probably been more helpful to educate the coaches and the support staff, things like that. Then educating all the wellbeing staff that we have who look after the players off the field. And with those two people, they're very good at identifying certain traits, certain things that they may refer them on if they're struggling. The NRL is taking a really proactive step. We're currently having talks. We have a thing called the rookie assessment. So basically, if you're brought in through the junior systems, you do a range of assessments which range from everything from drug and alcohol to mood to anxiety to depression. We're now basically going to probably throw in a couple of ADHD screeners as well.
Brilliant.
Because we're finding the prevalence is very high. We're like almost 30%.
I think that's really interesting. I often talk about, I think there are team sports. It tends to be higher from what I see so far. There's some research they've done in the US on basketball. And when they look at the levels of therapeutic use exemptions for ADHD meds in basketball, they're already very high. And I certainly know a lot of the basketballers I work with diagnosed, but they don't even take meds. So
Yes.
we would expect that to be a lot higher than kind of we think of the 5-10% of kind of general population who have ADHD. You work in teams.
Yes.
I work with individuals in some teams, but I also work a lot in individual sports.
I've always been interested to know the differences of what you see individually versus mostly my team environment.
So yeah, I'm really intrigued. I haven't seen research. It's really interesting. Someone actually in the US messaged me recently about did I know specific interventions that help athletes with ADHD in tennis? So I went onto the university website where I do some lecturing and I was like, right, let's have a proper research. Nothing, absolutely nothing. There is a lot of research about the benefits of exercise for those with ADHD. And so they might set up a tennis intervention for those with ADHD to see whether learning tennis can help with emotional dysregulation or focus or attention, right? Actually, very, very little research done on athletes who have been diagnosed with ADHD and what interventions might support them. So, I mean, all the 3 chapters of interventions in my book, but they're all based on what I find works with athletes rather than being particularly evidence-based, because there just isn't an evidence base out there. So it's hard to know, are the prevalence levels higher in individual sports, in team sports? I think it's probably easier for athletes to mask in individual sports, might well not come out. I also probably think I see more perfectionism in individual sports than team sports, because you've got more control, and those with perfectionism probably don't like the lack of control of being part of a team and having to depend on other people. So yeah, I probably say I guess I would see about the same amount, but it's easier, probably slightly easier to cope with, or doesn't get picked up in the same way when you're an individual athlete than when you are a team athlete and you have a coach that's observing you probably very closely. You have to be at competitions or training on time. You have to sit down and listen to a coach. And a coach, one of the stories in the book, one of the mums was talking about how her daughter would go to trials for netball, but because she'd been moving around and jigging about, that was her way of tuning into what a coach is saying. The coach translated that as, she's not listening. She doesn't really want to be here.
As they've been misconstrued, yeah.
Totally. So yeah, I guess I probably reflecting see about the same amount, but it doesn't show up the same way in individual sports, or as obviously as it might in team sports. But I'm really intrigued by your thoughts.
I think team sports off the top, I think there's a lot more comparison.
Yeah.
there's a lot more competitiveness because, I mean, you're vying for positions. You're probably more prone to rejection and criticism, sensitivity, people pleasing going wrong because, I mean, the coaches are opinions, they're not facts. One coach may think you're fantastic, whereas where another one might think that you're not up to scratch, so you don't get picked in the squad. Whereas you join another club and you're a starter every week. The idea of culture, hugely reflected. I mean, we're looking now at the idea of trauma in sport is huge at the moment, and the trauma-informed kind of organisation that can happen. Culture's a massive part here, and we're seeing a lot of the coaches over here at the moment. The real successful ones are very good man managers, not tactically. So I think, it's that comparison to others. It's the cognitive distortions or the automatic thoughts that come up when I'm not getting picked, when this happens. Perceived criticism and comparing themselves to others in the team. Some people work well with competitiveness. As we said, ADHDs generally need a challenge, but also if they feel that they're not doing well, they can just as easily jump out early. So it's understanding that, I think, but I'm just, again, no research. I'm just thinking that I'm wondering if it's easier to pick or harder to pick because they can dilute themselves amongst other players, but also other players can very much, there's people watching you all the time.
Yes.
Going back to what you said about individual sports, I just went back to that idea of cognitive flexibility or cognitive inflexibility and how individuals in individual sports, they can do things their way.
Yeah.
Like
they can find a way through.
They've got more of a say of the type of training, of the activities. A lot of team sports, you turn up and you do what the whole team's doing.
Yes. I think in individual sports too, you can feed that novelty striving. That's harder in a team because you have to do often what you're told at the time you're told to do it with the people you're told to do it with. Whereas, I don't know, if you're in a sport like cycling or running, where you're doing things individually, I call it magpie syndrome, that idea of like, oh, that new shiny thing, that new technique, that new piece of equipment, whatever it is, the new compression tights or the new icing your legs, whatever the new thing is, you can feed that a lot more easily in individual sports and get that dopamine from the feeling like I'm doing this new, different, novel element.
We actually also say, just reflecting the team environment, those ideas of individuals with perfectionism who overdo a lot of things can often get easily frustrated with other teammates who they don't think are coming up to standards or aren't doing as much. And you sort of see those types of conflicts as well, because your outcomes are my outcomes too.
Yes.
We've got one player I've spoken to definitely has those attitudes. He said, we've got each other's careers in our hands. I can't see why people can't just meet standards. It's not hard. But where his standards are and what's acceptable could be two very different things.
Totally get that. I'm intrigued when you're going into teams and you're talking about ADHD in sport, how many of the coaches have a light bulb moment and go, a
lot. I'm going to be very careful about this. I've got my suspicions about a lot of coaches being neurodiverse themselves. I'm actually finding a lot of the helping and the wellbeing stuff seems to be a lot of neurodiversity as well, which we know. You do find a lot of neurodivergence or ADHD in helping professions. A lot too. And some of them sort of go, that's why this happens. And it all makes sense. But it's just so different from the norm of the last 30 years because most are ex-players. And this is the way they were coached and this is the way they were shown and this is what worked for them.
Do you find that light bulb moment, though, can be helpful for people? I think one of the most compelling phrases that was spoken to me while I was doing the research for the book and interviewing all the athletes was somebody said, when I got my diagnosis, I realized I wasn't a broken horse. I was a zebra. And I just loved that because some people are like, I don't want the label, I'm just who I am, I want to be treated for who I am. Brilliant. But sometimes if life has been really difficult for you and you've spent a lot of time trying to understand why you might not feel like you fit in or that there's something wrong with you, to understand there's nothing wrong, you've just got a different brain.
Correct.
I can see that really lights up some people, really helps them.
Yeah. And even just a few of the traits that you can describe to them, you can almost even go, yep, yep, yep. And a few people have said, have said things like, oh my God, you can read my mind. I'm like, no, these are just typical presentations that we see. Yeah, absolutely. I mean, that analogy of the zebra I love. I mean, I love the one from ADHD 2.0 where you've got a brain that's a Ferrari engine, but you've got the brakes for push bike.
Yep.
You'd never sell a Ferrari engine, right? But you up the brakes, which is what we sort of do. Yeah. Look, I find like smaller traits. A lot of the players I see are actually quite intrigued because of that role of stimulants. Whether it's recreational drug use in the off season, or they drink about 8 coffees a day, or Red Bull, and they're like, "Oh no, I can go to sleep, or it has no effect on me." And you're like, "Oh, that's interesting," because it's one of those biological signs we see in a lot, where stimulants actually have that reciprocal effect. It actually calms the focus. And that's where a lot of players actually turn around. And a lot of the courses I've done where I mention that, and that's often the first one where a person will go, "Oh, I noticed what you said about stimulants. That's me."
Yeah.
Or yeah, I drink 3 long blacks and I can sleep. It's like, you shouldn't be able to do that.
Maybe
so
that'd be a lot easier diagnosis, wouldn't it?
Yeah, showing that there is that biological, it's genetic. It doesn't come from bad parenting. It doesn't come from being, it's genetic.
Yes. Brilliant.
And then they start saying, "Oh, my dad, oh, my mum, oh, actually, my brother does this." And like, it's, yeah, as you said, the family's the whole diagnosis.
Yes, it comes back to that. You diagnose one person, you start to diagnose through a whole family. And hopefully that really helps because suddenly light bulbs go off all over the place. And I really believe that the more you realize it's just a difference, it's not. I hate the fact it's got deficit and disorder and all of those words connected because it's a difference. And it can give you some phenomenal ways of performing. It can also give you some barriers that you need to overcome. Which I guess leads into my final question. What's your favorite go-to tool or technique that you use with an ADHD athlete that you're like, this is something I feel I see makes a difference with people?
Okay. This is tricky, and you can't restrict me to one. You can't do that to an ADHD person.
Can you do 2?
I think because every presentation of ADHD is so different. It's like a thumbprint. I think the short-term, long-term parts of dopamine that we discussed before, I think is really important, especially for those who've got themselves into trouble or got themselves into burnout or those sorts of things. Understanding RSD or rejection sensitivity, I think, is a big one. For those who are perfectionists, I actually find acceptance and commitment therapy strategies is really effective. Not more how better can you go, more where can you let go. If this bit needs to increase, something has to decrease. You can't sprint a marathon. So showing them those things. Radically open dialectical behavior therapy does some stuff with perfectionism too, but I actually find we don't get players that long enough to have that sort of intense treatment. So the acceptance and commitment strategies tends to work. And then something that we've talked about before that you loved is showing them the difference between procrastination and stimulation.
Oh, say more about that.
If we get home and we need to rest the brain, we can scroll.
Yep.
Is that procrastination or stimulation? Mostly it's procrastination, right? Procrastination, it will recharge the brain, but probably the strength of the solar panel. Stimulation is one of the greatest sources of dopamine for ADHDs. It's what they go for. It's what motivates them. So it's really hard to define it to athletes, but the way I do is something that you feel progresses you.
Love it. Yeah.
Rather than watching the same clips on YouTube Shorts or whatever, it could be something that you've been interested in, that you want to learn about. It could be going out with a certain group of friends who you feel lifts you, who you learn things from, who you feel a better person around them. Rather than listening to music, you might play it. Yeah, it's doing those little small things. But unfortunately, when they're feeling those depressive and anxious symptoms, putting a bit more energy into something is often very hard. It's the barrier.
Yes. I do find
know,
Duolingo is incredibly popular
yeah.
with ADHDers because
I've done
yeah,
street,
you're striving towards something. It feels productive while you're going through that process. So I can see why those things would be so helpful.
but it can be twice the fall if you break your streak.
Yeah.
Whereas stimulation, those stimulations will charge you, not like a solar panel, but like a nuclear power plant.
Brilliant. What a lovely note to end on. Charging rather than a barrier. Thank you so much, Steve.
No, thank you. And congrats
Really
to the
helpful.
book.
I've already taken away some elements that I want to go and use in my practice. And hopefully everybody watching has maybe a different understanding of ADHD or a real understanding of how it works in sport. So thank you.
Thank you for having me, and thank you for your help and assistance too.